Hi, this is Priyanshu, currently studying BSc in Trauma and Emergency from some medical college. Today we will discuss brain injury. It is the leading cause of mortality following trauma. And one more important thing, that is neurogenic shock. Patients having had injury and BP is decreased, along with BP is decreased, then in that case we can say that it is neurogenic shock. So brain injury is mainly divided into two types. One is primary and the another one is secondary. So the primary is that when it is the impact with any other object, and the secondary is due to increase in intracranial tension. So secondary is not so important, so mainly important is primary one, so we have to discuss it. So the first one is concussion, and concussion is the mildest form, and it is mainly happens due to contact sports, example boxing. Actually concussion is caused by blow to the head or a violent shaking of the head and body. So if we see the NCCT in concussion, then it is normal, as it is the mildest form. So the next one is diffused axonal injury. Diffused axonal injury happens when the brain shifts and rotates inside the skull during a sudden violent blow to the head. As a result, brain nerve fibers or axons are torn or sheared. So it is the most severe form, and the prognosis is also worst. If we see the clinical features, GCS is not improving in patient, and NCCT, if we observe NCCT, then NCCT is normal, but in MRI we can see punctate hemorrhage. So now we will discuss intracranial hemorrhages. There are mainly four types of intracranial hemorrhages. First one is intraparenchymal hemorrhage, then extradural, then subdural, then subarachnoid. So intraparenchymal hemorrhage is the most common traumatic brain injury, and in this brain injury most commonly temporal lobe is affected, followed by frontal lobe. And if we see the investigation of choice, then it is again NCCT of it. And also it is the management is conservative management, and conservative management means non-surgical management. So this is about intraparenchymal hemorrhage. So now next is extradural hemorrhage, extradural, or you can say epidural. So it is mainly commonly occur in mostly young patients due to increased velocity impact, and in this hemorrhage middle meningeal artery also injured. So if we see the clinical features, the most important clinical feature is that lucid interval. So lucid interval is a period of normal consciousness between two episodes of impaired consciousness. So again, investigation of choice is again NCCT of it, where we see biconvex lens. NCCT, in NCCT we can see biconvex lens appear. So the management is craniotomy or burr hole. In some cases, small holes are drilled in the skull to assess the brain. This is called burr hole. And in some cases, craniotomy is performed. Craniotomy is actually a large section of skull is removed. In case of, we can say, tumor or skull fracture repair, etc. So this is about extradural or epidural hemorrhage. Next one is subdural hemorrhage. Subdural hemorrhage is again divided into three types. So this is, first one is acute, which is occur less than 3 days almost, then subacute 3 to 21 days, and chronic is more than 21 days. So here in subdural hemorrhage, cortical breaching veins gets injured, and if we see the NCCT, Then here crescentic hemorrhage is seen. So the last one is subarachnoid hemorrhage. It is simple, very simple actually. It is the bleeding in the subarachnoid space. Subarachnoid space is the space between the brain and the tissue covering the brain. So again, it is the most common cause of trauma, and the investigation of choice is NCCT of it. All this is all about brain injury, and one thing remember that in brain injury or head trauma, main thing is that investigation of choice is always NCCT, non-contrast CT scan.